service levels, but a very significant change took place a couple of weeks ago when there was a determination that it was no longer safe to have visitors come unrestricted into our long-term care facilities, and similarly with hospices and a number of other institutional services where people are residing. So the important piece there is that a number of the family members that come in for visit have also been very supportive in caring for their family members. And when there was a decrease in the number of visitors, that placed increased demands on the staff to the point where we're really looking at up to 64 additional staff required each day to be able to provide care for our residents. Our human resources and customer service staff have had increased demands placed upon them, a number of questions coming through and requirements for staffing changes. Communications or information distribution across the municipality has also been very heavy. Economic development and building development, those are two services where there's significant changes or pivots to respond to the current situation. While we haven't been out attracting new businesses to the community as much, there's been a huge level of support required for businesses that are going through the COVID crisis. So looking at business support and recovery, that's been a combination of different things, identifying what senior government programs are available, helping support our digital mainstreaming to help people have a presence online so they could carry on some business activities. Those have been very heavy. Similarly, with building development, we have not been doing as many inspections of construction sites, but there has been a very large increase in workload as the building development team have taken on increased responsibilities for bylaw enforcement, and those have balanced out. I won't go through all of the services on the right-hand side, but all of these different activities have I've identified, have been maintaining their activities. Although there, as you'll see in a moment, many of them have had adaptations that have had to be made so that we could continue to offer the services. And I just think for the benefit of the people watching as joining us this evening for the council meetings, a lot of these services you don't think about on a day-to-day basis, but if they were to not be offered, they'd have a significant impact on the people at Chatham-Kent. So the expectation is that we maintain our service levels. Next slide, please. There have been a number of public health orders that have actually closed facilities. And so these have been fairly prominently identified in the media. Again, I won't go through all of them, people can look through, but in general, all of these different activities have a common element that in the facilities or programs, it's very difficult, if not impossible, to maintain the required level of social distancing. So the last bullet on the right-hand side notes the schools and the childcare services were closed. That came very early in the game, and Dr. Colby and others have been very clear about identifying why that was so important to try and stem the transmission of the disease. So in all of these cases, public health orders were issued, and there has been a closure of the facilities. Next slide, please. So to give people an understanding of what we've been doing, most of the staff have continued to do their regular jobs, but the adaptations have included transferring a lot of the services to online phone services. In many cases, we've had drop boxes. There are a couple of instances, and there's two that are identified or a few that are identified on the end of the slide here, where if we're issuing a marriage license or a death certificate or an affordable bus pass, some of those services require direct contact, meaning that we have to do a face-to-face transaction to exchange documents. In those cases, we've had enhanced screening and by appointment only. But for the most cases, we've tried to deliver services in a way that is safe for the clients and for the public, and enhanced our cleaning and personal hygiene measures, making sure there's increased hand washing, etc. Also ensuring that people, wherever possible, could be working from home or in different locations where we could have the social distancing. Next slide, please. These are some additional examples of how we've actually changed some of our activities. The work at home locations are intended to promote work isolation, the same as self-isolation, but you're trying to distance yourself from colleagues. We've, in some cases, moved people out of some of our larger centers, such as the Civic Center, and those people have been relocated to other areas such as the arena boardrooms, where we have hardwired facilities so people can connect to our internet services and networks to provide ongoing work services, but they're not doing that in an area where there's as many people, so it's much safer. Some of the considerations we've had for outside workers, again, trying to ensure social distancing. So things as straightforward as only having one person in our trucks, or we've had to put up barriers between the people that are traveling to make sure that they're going to be safe. Fire and RVG, we've had enhanced screening facilities. So as an example, every firefighter, when they're coming on onto a shift, there's a requirement for them to take their temperature and to report on self-monitoring that their condition is safe for them to enter the workplace. Next slide, please. Okay, I'm going to turn it over to Kathy. Hoffman, who's going to walk you through a couple of slides on how we've been dealing with our balancing our staffing and services. There have been some direct impacts. Kathy.
Thank you, Mr. Mayor. Thank you, Don. Don referenced a few slides ago about where you see areas in the organization that have had an increase in activity and areas that are maintaining service, as well as some of those that have had a decrease. And so these next couple slides will talk about how exactly are we balancing our staff and our services. So from our culture, our resident attraction, leisure and recreation areas, the POC, the planning department, we have had employees from all of these areas that have been offered redeployment in other areas of the organization where we have positions that are available to them. So you can see it's not just about one particular department. We really are trying to look into each division and say, where do we maybe have capacity in one that we could share it over to another one that's having a little bit of a surge. Our arena staff, as an example, as our arenas close, employees are being reassigned to sports fields to provide some minimum maintenance service that Don referred to in one of his earlier slides. I've had people ask me a little bit about what's happening to our arena staff if we no longer have ice in. Our library employees, I shared with you on Friday that we had 47 unionized employees from QP 12.2 that have been laid off. The non-unionized employees who are a part of the library group have been redeployed to Riverview Gardens and to the Economic Development Recovery Initiative that John has spoken with you about previously. There are a variety of roles that we have at Riverview Gardens right now to try to take on that surge, and they include a series of things that I'll talk about in a few minutes. Our summer student hiring has been suspended. That impacts up to about 185 of 200 positions. There have been a handful of positions that have been hired up specifically in the area of Riverview Gardens. To start off with, certainly we still need some of those students there. We need some of those hands on deck, and some of them are actually doing part of their coursework for getting hands-on experience in that particular area. Meredith, next slide, please. In addition to the things I've just spoke with you about, we've had a couple of other staffing strategies. So a number of our employees right now are using lieu time and vacation, where they have had maybe slower areas and where we've not yet necessarily found an area to redeploy them. This has been particularly handy because from time to time when we've had very busy periods and employees accrue extra time, it can also be very difficult to get the extra time to take off. So this has been helpful in that regard. In the case of part-time or casual employees, their hours of work are being reduced where work has slowed and where redeployment is not yet available. So this is also helpful because we still have employees coming here that are part-time and casual, but we're simply not assigning hours. And some employees have requested personal leaves of absence right now. They have personal situations for which they are happy to, have time away unpaid right now to tend to some of their own personal matters, and we're honoring those where possible. We're also currently analyzing the workload of the balance of the staff that we have in play and that are providing services, and we're comparing it to our redeployment strategy needs. So our redeployment strategy consists of a couple of different initiatives that have been identified by the executive management team as needing additional resources either right now or in the coming couple of weeks or month or two. And so we have a full strategy bubbled up right now that we're taking a look at where are our employees, forecasting with our EMT colleagues about when they expect maybe that staffing might get a little, or work might get a little lighter in one area or heavier in another. And we're literally making a match between those two parties. In an ideal world, we would have as few layoffs as possible. and if we are in a layoff situation, we would be having an opportunity to redeploy and have employees back to work as soon as possible. Depending on how all of the analysis goes and the timing of who's having a shortage compared to who's having a surge, there is the potential for up to about another 100 more layoffs, subject to the redeployment needs at the timing of the facility reopening as well. Meredith, next slide, please. Okay, Meredith, sorry, I think we've just lost our slide here. I'll attempt to speak to it anyway. So we also have, in terms of employee support and labor relations, can you still hear me? Just have a check-in, please.
Yes, we can, Kathy.
Okay, thank you. So in terms of some of the supports and labor relations that we're providing, we have set up what we call an employee self-service portal. So it's right on our intranet internally, and it's been established, and it contains a lot of vital information for employees. So it talks about requirements for reporting if they have had travel, which was more relevant a couple of weeks ago, obviously, but still in play right now. It also makes requirements of them to report for us any particular kinds of illnesses so that we're tracking along with an employee where they're at. And there's also a lot of valuable resource information that we've provide, health education for our employees, government resources for leaves and subsidies that they might be eligible for. And this portal is particularly handy because employees don't have to be at work to be able to access this portal. They can do this from their own account from home or their phone, etc. We've also implemented a series of employee communications that we are issuing regularly by myself and others in the organization to address issues of the highest employee concern. So on a weekly basis, we hear feedback from employees about what their concerns are, and we either deal with those one-off by department or in a larger communication. We have set up an employee COVID-19 hotline and a one-stop email address that has been set up since this was announced and since the state of emergency was put in place. And supervisors have an opportunity, as well as employees, to have any of their questions triaged through this mechanism and answered very quickly, and it's been working very effectively. There have been a series of worksite meetings in various departments. If we have employees who have expressed concern about something in their particular area, we put together a team that goes out and visits employees, made up usually by the general manager of the and oftentimes a member of the public health team who also comes and assists and fields questions. Finally, our last two is we have provided an income protection period for 3 weeks for all employees. It was up to and including today, April 6th. And so this was at the start of the COVID pandemic. There was huge concerns from our employees about whether or not they were going to immediately lose their jobs, have their income stopped, etc. And so we said, we provided them with a guarantee of income for that particular period. And so now that is just passed. I would be remiss if I didn't mention to the group that our labor groups have been really engaged and quite helpful. They've been willing to come up with creative solutions to be able to make sure that members could be accommodated for the various kinds of issues that they may be dealing with, for example, things like childcare. And so they've been willing to examine where collective agreements are at and the language that's in them, and on a temporary basis, be a little bit flexible around some of the language to assist employees in what it is that they require. Next slide, please, Meredith.
Thank you. So just a couple of final points before we open up for questions. Council is aware that we look to you for determining the scope and the levels of service that are delivered in the municipality. In some cases, for the people that are listening in, it's important to note that a lot of the time some of the services and the service levels are established by the provincial government, who also contribute approximately half of our revenue to the municipality. So we deliver based on those standards as well. But council is also responsible for establishing the budget and the resources that are required to deliver those service levels. So at this point, we think it's appropriate to check in with council and to seek council's feedback and direction as to where we are with respect to adapting to the COVID crisis. A number of different points here. With respect to our services, we've already made some adaptations in terms of how we delivered services. In some cases, and I'll give you a couple of examples, we've had to do a pivot and slow down or suspend some of the term priorities that council had identified. One example would be that we had a very strong push to try and deal with work on environmental sustainability, and council's heard a number of times from Gabriel Clark and the type of work he's doing. Gabriel was planning on going out this spring and doing a number of public consultations to help support our work in environmental sustainability. The nature of that work and the consultation doesn't lend itself very well to the COVID crisis. So rather than have a difficulty in doing the type of interactions or civic engagement, we've asked Gabriel to help support the economic development team in helping understand how we can provide additional support to our local businesses that have been affected by COVID. Similarly, Audrey Ansel and her team that's involved in resident attraction and retention, also an equally important priority, but very difficult to go out right now and try and suspect anybody's going to be thinking of changing their location or where they're going to be living. So where we can, we believe we've actually shifted resources and taken people with skill sets that can help provide support where it's needed most. I think the other piece that we want to highlight, and Mr. Quinton's done a great job in a report the council will be considering in a few minutes, highlighting that the municipality is in a very good financial position. We've taken the financial sustainability goal that council has adopted as part of our strategic plan, and we've made sure that our balance sheet is healthy, and we'll be talking about that in a few minutes. But when it comes to a crisis like this is where that concept of resiliency that we've also built into our strategic plan comes to the fore. So we believe we've actually prepared for this. I think the team's done a great job adapting, but I think over the course of the next several weeks, as we expect the COVID crisis to continue, I think we may have to make some additional changes, and this is where we're looking for council's direction. Specifically, the plan is to share with council where we are today, but also to notify council that our plan is to, over the next 2 to 3 weeks, to continue to work on a plan for where we can make further service adjustments and seek council's approval for us to change some of those service levels over the course of the next several weeks or months, as the case may be. So just one example, we currently are offering the services that council has approved as part of our budgets, but those range of services are very broad in scope. And I've used one example here just to try and make the point. We have in November, we purchased a number of flowers that we'd normally be planting around this time of the year, when we've got people that are being told that they no longer have a job or they've been laid off or whatever. To spend municipal resources to go out and plant the flowers might be something that requires a second look. Whereas there's other services we're presenting to them or sharing with the municipality, things like maintaining a safe water supply, that we think no matter how long this crisis goes on, we'd still want to maintain those. So what I tried to paint there is there's a range or a continuum of services ranging from things that are things that are quite essential to things that, there's a whole lot more discretion. So what we'll be doing as administration with council's approval is to go through that continuum of services and to come back to you in 2 to 3 weeks and make some recommendations as to where we can actually set ourselves up for some of the financial sustainability that might be required if we have an extended response to COVID, if this lasts for several months. I think the other one important piece before we open it up for questions, and that's the last piece that's in yellow there. As much as people look at our service delivery, and we think we're very much in line with our neighboring municipalities that they've gone through a very similar thought process with the reductions that they've had in their staffing levels and how they tried to focus their resources. We also have to consider that the anticipated infection rate for COVID-19 is between 30 to 70%. So all of those essential services that we need to continue to offer to the municipality, we have to be able to make sure that we've got enough of a capacity in our staffing that if we do have a substantial number of people becoming infected, we still have the capacity to be able to respond. So that also has to be factored in as we make recommendations to council. With that, Your Worship, Kathy and I would be happy to answer any questions or any other members of the team. Thank you very much. Next slide, please.
Okay, we'll open it up to questions. We'll start with Councillor Thompson, followed by Councillor Latimer.
Wow, that was fast. All right, I didn't expect to be first. Thank you very much. One came through to me on social media just a little bit ago, and this was a pretty broad discussion, so I'm not sure who could take it here. It's in regards to mental health supports, specifically for the elderly. This question came from Irio. How are we kind of combating the loneliness and mental health for particularly elderly individuals and those living alone who may not have access to computers or social media to try and keep that human connection?
April, would you like to start? And I'm happy to offer some additional support.
Sure, Don, thank you. So through you, Mayor Caniff, thanks for the question, Councillor Thompson. What currently is happening, certainly as we work to some kind of medium and longer term plans as the pandemic unfolds, is we are working with United Way on one side of things, who are pulling together a number of volunteers and community agencies who are willing to go out and assist, whether that is, a friendly person to talk to some seniors who are sheltering on their own, whether that is a way to assist in terms of picking up groceries, and the like kind of around that. They are assisting in terms of individuals who require transportation to medical appointments or anything else that certainly vulnerable seniors find themselves in as they are sheltering in place. With respect to our community partners delivering programs and services, we are working together to try and really get a full assessment of what's out there and what's needed from a professional capacity. So certainly in ongoing conversations with Canadian Mental Health, with Chatham-Kent Health Alliance in terms of any of their programs and services, our community care programs as to whether we feel that individuals require some in-home support. So all of those partners are working together to the best of our abilities during this time while we all navigate through COVID-19 pandemic. So I'll stop there and then see if Dawn has anything else to add.
Thank you, covered.
All right, still had a different question on a different topic, since again this was a wide-ranging one. Had a lot of feedback from the community, and to be honest, it's kind of echoed my own thoughts that potentially the municipality isn't moving fast enough to either issue layoff notices or find those positions that unfortunately would be deemed redundant in the face of the COVID-19 pandemic. I know the employer I work for moved very quickly, March 12th, March 13th. A lot of other employers slashed their employment levels to half, and yet they look at the municipality, and we're thinking about flower planting and finding those particular roles. So when you say you're looking for direction, I would say that back on March 23rd, I brought up the issue of this, and I don't think we're moving fast enough. I know there are places that we can find spots to move some employees, like you said, RVG and the like, but at the same time, we need to see those those movements come quicker, I believe, especially as this continues to move forward. So again, I would like to see some quicker cuts, some quicker layoff notices go out, unfortunately, until we can really get a handle on this. I'd rather send them out and then have to recall them than be delayed longer than we need to be. Those are my comments. Thank you.
Okay. Thank you, Your Worship. If I could, the municipality has now a total of, looking at the not hiring people, and the layoff notices we've already issued are impacting approximately 250 people. I think the other municipalities around us, if you looked, I know there's a big announcement, for example, last week with the city of Windsor. They announced 541 people were being laid off. When you take a look at their announcement, over 446 of them were part-time casual staff. And in the report that they issued, approximately half of those are going to be called back. To the best of my knowledge, we're the only municipality in our area, with the possible exception of Guelph, that's actually issued layoff notices to full-time staff. So I think what we've done is responsible under the circumstances, and I think it's in line with what the other municipalities have done. As I've said, I don't think that's, we're not pretending that that's the only changes that might have to be made, but the municipality has been identified by the province as an essential service, and what the administration is doing right now is we're going through each of our different services. For example, road maintenance has been identified as an essential service. So we need to determine exactly how much of the other activities we'll be doing for public works and engineering would still be continued, in addition to things like maintaining our roads and our bridges. As we've continued on through this the last 3 or 4 weeks, I can tell you that we've not had a reduction in the number of people that have come forward and said, I've got a problem with, and then they name the municipal service or something else that they wanted attention to. So I think that's the other thing that has to be considered. The municipality is expected to respond when people call. And if we don't have people in place, we're not going to be able to do that. So I take your point. We've made a commitment that we will be back to council, but when you can see the number of services we offer, we need some direction from council as to where you'd like to see service reductions, not just talking about staff reductions. Thank you.
Councillor Latimer.
Thank you. Through you to Dawn, I wanted to say thank you to you, Dawn, and the EMT and all your teams, as well as all our employees and their labor unions, for your continued efforts to provide services in a safe manner for all of us. I think through your diligence and the behind the scenes works especially, we've been able to follow Dr. Colby's recommendations, and that is currently why we're experiencing relatively just significantly lower COVID levels and than the neighboring municipalities. And I think that's a good thing. We can all cross our fingers and continue those recommendations. People continue to observe them, and we stay where we're at. With regard to our employees, I had someone question me yesterday. They were wondering if we could offer some of our staff who, for whatever reason, are not going to be able to be deployed within our own municipal organization, that we could offer them on a secondment basis to those other frontline employers in the community currently experiencing short staffing. Now, I realize this would involve not only the private employers and their unions, along with our keeping them on their own individual employee circumstances, but that was something that I think they were thinking that would keep the employees working while supporting our private sector.
Thank you, Councillor Latimer. I just have a couple of initial comments, then Kathy, I think, needs to add some additional thoughts. We have actually been approached by a few people in the healthcare field, certainly Chatham-Kent Health Alliance, and also Transform, who does a lot of the procurement and purchasing for healthcare providers in Chatham-Kent, and also our Erie St. Clair Lynn. They've each of them have approached the municipality and asked for some additional support in response to the COVID crisis. So as an example, we've been asked to set up a depot that could be used for receiving and distribution of personal protective equipment, which many of you have heard is in short supply. So what we've offered to do is to provide one of our municipal buildings that's been closed to be able to do that. So we are already starting to do that process. I will let Kathy respond to the other pieces, but I think we need to have some direction from council as to if people are going to be retasked to do other things in the community, how that would be paid for, and whether that's something that would be supported by council. The other piece I think is important is that the voluntary sector and the private sector have both stepped up to make contributions. We've had volunteer, United Way, as April talked about a few minutes ago, has stepped up in coordinating donations and volunteer activities, and members of the private sector have also stepped up to see how they can contribute. So I think it's a full court press to try and respond to this, and we need the entire community engaged. Kathy?
Thank you, Mr. Mayor, and thank you, Councillor Latimer, for your question. Notwithstanding the suggestions that Dawn just made about if we were to proceed with deploying our employees to help with other kinds of community volunteer work, and the fact that we would need to have council's support and endorsement on some of these things, which I completely agree with. What I would say to you is I certainly like the idea. We are keeping a running tab of the areas in which we have project work or particular surge, as I talked about, and I'm happy for us to be able to examine where there might be other possibilities that our employees, if not here and if not deployable someplace else, might be able to add value to the community as a whole. Certainly one of our goals is to stay engaged with our employees while they're away from us. We want to stay connected, to go back to the slogan that you see out there, being together while we're apart, I think certainly applies here. And we'd like the opportunity to make sure that employees are feeling a part of the solution that moves COVID-19 through our community and not be idle during a period of time if they're not with us. So thank you for that. And I'll certainly give that more thought as we go through our redeployment strategy.
Councillor Bondi, followed by Councillor Oche.
Hi, thank you, Mayor Caniff. Okay, a couple of questions. First one's pretty easy. We did speak about, or on the chart, marinas are closed. My question is, are boat launches also closed, like the one that's inside the city of Chatham in the park on Grand Avenue?
I'm sorry, Councillor Bondi, I could not hear your question. If it was directed to me, I'm sorry, I'd ask you to repeat it, please.
Okay, Don, can you hear anything, Don? Hi, Don, can you hear me now?
Councillor Bondi, we can hear you, so I'm not sure if the problem is with Dawn's.
Oh, okay, great. So shall I repeat that question?
Your Worship, it's Kathy. I heard Councillor Bondi's question. I think that's a question best answered by Thomas Kelly. Thomas, are you able to answer that question?
This is John. I'll just jump in and say that I'm not sure where Thomas is. If he is there, he can jump in, but go ahead, Thomas.
Oh, sorry, could you repeat the question, please?
Are the
Sure,
boat ramps open, Thomas?
Yeah, okay, so I'll just re-ask the question. Marinas are closed, municipally owned arenas, marinas, not arenas, marinas. So the question is, are boat launches that are municipally owned, are they also closed?
Thank you, Mayor. Boat launches, if they are within a marina, are closed. And if they are not, they remain open.
Okay, great. Now, my second question, which is a little more difficult, I've received a lot of, well, I actually haven't received a lot. I've received a couple of emails, but through social media, I've viewed a lot of pushback on what I don't know we call the call-in line, perhaps, on social distancing, which is AKA the snitch line people are referring it to. So this is a concern for many, a concern for me personally. I'd like to know where we are on that. Is it effective? Is it necessary? And in all transparency, Mayor Kenneth did respond to an email that I sent out, you know, when I kind of questioned the necessity of this. So my concern is that it will possibly be used for the wrong purposes. You know, where are we? Are people telling on each other because, you know, there's too many people in their backyards? I would like administration to engage the public on why this is necessary, because it does seem a little police state-ish, you know, not that it is, but, you know, if you read the stuff online, people are a little concerned about, you know, a call-in line. This is not exactly, you know, tips on an armed robbery. This is tips on people having a barbecue in their backyard, which is a little concerning for people. And just to follow up on that with your response, if you could also assure people that when this pandemic is over, which nobody knows when that switch will be flicked, and hopefully someday, will this call-in line be discontinued? And what is the effectiveness of it now? Because it's been in place for a little bit, not a long time, but it's been there. Has it been effective? There must be data, obviously. So yeah, if you could comment on that, I'm sure many would appreciate it. Thank you.
Okay. Thank you, Councillor Bondy. I'll begin and I'll ask Mr. Norton to step up if he has some additional thoughts. So to be really clear, that public safety line was established. We were receiving a great number of calls into the municipality, and I'm not trying to exaggerate. There was lots of calls coming in. Initially, they were coming into the 911 service, and our police services dispatch service was having to deal with them, and that was we do deem that to be relatively inefficient. These are people that were particularly concerned about their own health and safety, and they saw behavior which they thought was going to put themselves at a risk, put the people that were calling at a high level of risk, and so they were saying, what can we do about it? Up until about a week ago, the only people that could do enforcement for those were either our medical officer of health and their direct reports or the police. This was enough of a problem that the Solicitor General, the provincial government for Ontario, determined that they were going to expand the number of people that could help do the enforcement. In Chatham-Kent, the position we've taken is we have, right from the start of this, we've tried to work with people to educate them as to what the appropriate behavior is and what's going to make it safe for not only for themselves, but for the community of Chatham-Kent, and so they don't put others at risk. So we started off all along to try and educate people first, and it's only when the people are particularly reckless or they're disregarding some of those basic guidelines from our medical officer of health and others that there would be the risk of laying fines. So with that, I'll ask Mr. Norton if he's got any direct experience from his staff that are responsible for a large number of the bylaw enforcement pieces. John?
Thank you, Mr. Shropshire. Mr. Mayor, I guess I would add that we have been doing enforcement now for 5 days. We have responded to 193 calls. 76 of those calls were in regards to gatherings over 5 people. 60 of the calls were in regard to businesses being open that were questioned whether they were essential or not per the rules. 41 of those calls came after hours. So we've had a large number of calls. We've given out 92 warnings and laid 0 fines so far. I would add that it was the police chiefs of Ontario that requested, when the Premier announced that he wanted this enforced by the police, I believe it was the police chiefs of Ontario that came together and said that this would overwhelm police resources and pull police away from other matters. So it was requested that bylaw enforcement officers be able to do this. With respect to, so I think what we've done is we've taken an approach that is not heavy-handed. As you can tell by those statistics, we've not laid any fines yet. And while I understand the concern that what if there's a gathering of 20 people in a backyard, and are we going to go in and fine people? I guess what we're doing here is we're enforcing rules laid down by the Premier on recommendation of the Chief Medical Officer of Health for Ontario. And these rules have been set out under this current crisis. So what certainly would be inappropriate, heavy-handed rules in any other situation, our medical experts are telling us now that these are appropriate and required in order to prevent this disease from from spreading. So we do take it seriously because we're being told to do so by the province, and we are enforcing and needing people not to break the rules and not to put each other in our community at risk. We are getting calls from concerned residents who are saying, you know, there's a large gathering going on in the house next door, and I think this puts me and my family at risk. So they're concerned about that. So we're showing up at their door at that house and asking people to respect the rules. So.
Thank you, John. Through you, Mayor Kenneth. So can we be assured, and can the public be assured that when said crisis is over, that the line will be eliminated and we'll go back to our good old favorite of Crime Stoppers, which seem to be pretty effective for crime rather than barbecues? Sorry, and I don't mean to make a joke about it. I get it, but you know what I mean? Like, I just think that there's a feeling out there that, you know, this is an easy tattletale kind of line, and people are afraid of, you know, where that goes. And I don't have to go any further with that. We all understand that, you know, if I call my local municipality because my neighbor's having a barbecue, well, if they called on me, you know, I've got 7 people in my family, my immediate family, I could get a visit. We all live here. You know, it's kind of a big brother kind of thing that people, I think, are a little bit worried about. I am. And so back to the original question, can we be assured that we'll go back to our friend Crime Stoppers at the end of the COVID-19 crisis?
This is John, Mr. Mayor, if you want me to answer that. All of these rules that have been laid down by the province are contingent on the declaration of emergency. The Premier's original declaration was just for 14 days. It was just extended for another 14 days. And then I understand the legislature will have to extend it if it's going to go further. If that declaration of emergency ends, or when it ends, all of these legislative or regulatory rules go away. So this is absolutely all contingent on that. And I'll just add as well that what we've done is we have, because of the large number of calls we're getting, we have deployed some staff who's, you know, to these tasks to cover the phone line and to go out and do the enforcement, who, as soon as the emergency ends, will go back to their previous jobs. So we're covering their salaries now by existing budget, and they would just go back to their old jobs as soon as this is over. There's no intention to, in any shape or form, to make this permanent.
Great, thank you, Mr. Mayor, and thank you, Mr. Norton. That covers it, and we all look forward to the end of the emergency. Thank you very much.
Councillor Oche, followed by Councillor Harrigan.
Thank you, Your Worship. Through you to Don or Kathy, if we decide to have some of our staff, say, work at the hospital, are they able to turn it down if they want, just feeling unsafe with a chance of getting COVID-19?
Thank you, Mr. Mayor. Councillor Oche, you mentioned if they want to turn down work at the hospital. Did you mean Riverview Gardens?
Well, you said you were looking at a couple of different options as well. One you said was the hospital, and I know we already have people at Riverview Gardens, so I guess there as well. Yes.
Okay, so just for clarification, we don't have any employees that we're looking at redeploying to the hospital. The one place that we have been looking at redeploying our employees is at our long-term care facility, Riverview Gardens. There are a series of positions that are available for them to be able to assist in that don't require professional accreditation. So for example, we wouldn't take an employee who was a non-registered nurse and have them do work at Riverview Gardens. That said, there are other roles that with some minimal training and orientation, our staff are able to fill. So for example, in Riverview Gardens, it would be things like housekeeping, screening individuals who are coming into the building. They have an active screening protocol in place right now. So that means every employee that comes in, anybody that comes in and brings a delivery, et cetera, whomever is permitted to come into the home under their current protocols has to be screened every time that they come in. So staff are provided training in that regard. So your question was, could they refuse work there? So there are a few answers to that one. First of all, if an employee feels unsafe in their work environment, we do have a work refusal process that they would follow. So they would come and speak with their supervisor. They would walk through what those concerns and issues are. An assessment would be made to determine whether or not an employee was at risk. And if so, there would be precautions put in place, whatever that might be. And if not, then they would be expected to perform the work that had been laid out for them. However, we do have some employees who, as I talked about earlier, have asked if they could take this opportunity to, rather than potentially be redeployed, could they perhaps take some of their vacation or some lieu time? And as I mentioned, some have also talked about whether or not they might like to take a personal leave of absence, and while others might be eligible for something that the government has now set up called a declared emergency leave, or DEL for short. And so if they are eligible, they might be able to take that particular leave.
Okay, thank you, Kathy. My next question would be either to Don or Thomas. Are we, or is a bridge considered, well, I guess what I'm going to ask, I know we cannot start a new building if you're doing the construction, if it hasn't been started already. How does that affect our bridges?
Thank you, Mayor. It's Thomas. So we are evaluating all of the directives from the province, but at this time we feel that any bridge maintenance work that we have to do would continue.
Councillor Harrigan, followed by Councillor B. McGregor.
Excuse me, I missed
Sorry,
that whole
continue
thing.
on there, Councillor O'Shea.
That's okay. Sorry, I missed that whole answer. I'm not sure what happened, but I could not hear anything that Thomas said.
Mr. Mayor, we are reviewing the directives forwarded by the province, but at this time, based on our evaluation, that we feel that we can continue with any maintenance of bridges for this year.
Just one more question through you, Your Worship. So that means if we're tearing out a bridge and putting a new one in, we think we can do that?
Mr. Mayor, would you like me to assist with that?
Yes, please.
Sorry, are you not able to hear me?
I think Councillor O'Shea had asked a further question to you, Thomas. He couldn't quite hear your answer.
Yes, what my question is, so if we're tearing out a bridge, we're able to go and tear out a bridge right now if we wanted, say tomorrow, and start replacing it without any problems.
Thomas, we can't hear you. You still are muted.
I'm sorry. Based on what we know today from the province, we can still continue with those projects subject to change based on further direction from the province.
Okay, thank you very much.
Okay, Councillor Harrigan, followed by Councillor B. McGregor. Now, when I ask, if I get asked that when you are done your questions, if you could just say thank you, then I will know that you've ended your questions. Otherwise, I don't want to interrupt you. Thanks.
All right, thank you through the mayor. I just have a few questions in particular around the student hiring in the summer and some of the recreational organizations. So my first question with regards to the potential of not hiring students or currently not posting for any of our summer student jobs, have we communicated this to students who have previously hired so they're aware of their work prospects for the summer?
Thank you, Mr. Mayor. Yes, we have, Councillor Harrigan. We have been in touch with our summer students and given them an update on where we're at.
And then just in follow up to that, recognizing that the actions that we're taking now will really dictate how long we need to maintain social distancing for. If we have some great news and towards the beginning or middle of July, we realize that we're kind of coming into the clear, is there a plan to do some quick hiring, or do we have a date in which we say from this point forward, we know we cannot have any of our summer programming?
So, Mr. Mayor, right now, all of that is still very much a crystal ball prediction. Certainly, you hit it on the head, Councillor Harrigan, when you said, who knows when this virus passes its way through and the timing of it. So right now we're paying attention to the trends the same way that the rest of you are, and making adjustments to services and staffing as we go along. We've heard various periods of time under which we can expect to be under the, the dynamic associated with the pandemic. And this might be one of the conversations that's helpful to have April Reedike speak to in terms of what we can look for longevity-wise in the community. That said, we are being very flexible and very malleable and changing plans as we go. So I think to say if we saw some really good news happening and some things opening up, we would be on top of that right away to see what could be salvaged in any one of those areas that are currently closed, and look at reopening something for what would be the balance of the season.
So Mayor Caniff, would you like? It's April. I didn't know if you wanted me to add anything to that, Mayor Caniff, or not.
Yes, please. Yes, please do, Dr. Reedike.
Thank you. Thank you, Mayor Caniff. So, Councillor Harrigan, one of the things that I've had some significant discussion with in my area, specifically around kind of summer programming, is really, I think Kathy said it very, very well in terms of, this is a moving target and a crystal ball. But what we will look at is, even if restrictions are lifted, they are already thinking ahead about ways that they could begin to have some soft launches of programs coming back online, even if that means, while we might not be able to do our summer park programs, maybe we can look at doing some play pods in areas where as we are allowed to have some increase in gatherings and some activities for children. We might not be able to do swimming lessons, but we might be able to open up pools for lane swims. So some of those soft kind of openings, we already have people thinking about that and thinking about what that would look like moving into the future through the summer.
Great, April. And I also imagine that we're in our recreational areas thinking about how we can encourage movement for our students and youth in play if we are in fact self-isolating through the summer.
Correct.
Okay. My next question is, have we formally communicated or provided direction to different sports organizations, particularly baseball and soccer associations, about the availability or non-availability of fields, or recommendations about whether or not spring league should be taking place?
Mayor Caniff, it's Thomas. Yes, we have.
Okay, thank you. And then my last question is, I believe, directed to Dr. Reedike. I had a question about swap sites on Facebook, mom swaps, or online sales sites like Kijiji. Is public health able to give any formal direction around whether or not these are recommended or able to take place?
So Mayor Caniff, through to you, Councillor Harrigan. So I have tried to get some feedback on this, and I haven't been able to get anything yet. So certainly from a public health perspective, we are still indicating, is this an essential service or not? And does it meet any of those criteria if I'm, swapping clothes or toys? And I don't have any direction from a public health perspective. I don't know if certainly my colleague John Norton might have anything from a business perspective, but it certainly was a tricky question, and I thank you for asking it and giving us some time to look at it. But I don't have an update for you as of yet today. So I don't know if John has anything from a business perspective.
Can you repeat the question, please?
Yes, John, it was with regards to online swap sites, mom swaps, and then, you know, secondhand stores like Kijiji, and whether or not these are going to be regulated in any way.
Yeah, no, I don't have any information on that either. I'm afraid I've not heard any conversations at all across the province about that, really.
Okay. Appreciate that you may need time to come back and think on it. I think at minimum, providing maybe best practices for how people can do no contact exchanges of goods may be valuable. I would say at a minimum. And then I just also want to echo my thanks. I've had an opportunity in my work life to interact with some of the staff at the municipality and have seen in the community the work that people are doing. All we can do is really our best to prevent the spread of COVID-19, and I recognize that everyone at the municipality is certainly doing so. So thank you.
Councillor B. McGregor, followed by Councillor Hall.
Thank you, Mayor Caniff. As we've heard, there's been a lot of positive work in the community outside of just the municipality with private partners, not-for-profit organizations. Is there a role the municipality plays in compiling those resources? So something that individuals in the community can look to see how they can access services, or how they can volunteer or help out in any way?
Your worship, it's Don. If I could take a first stab at that. So the municipality reached out to the United Way several days ago, and the United Way was provided leadership and offered to step up and do the coordination of community resourcing in the voluntary sector, and also in the donations of either in kind or cash donations to help support people in particular that were living in poverty or didn't have the resources to be able to cope as well as others. So that's certainly taken place. John and the economic development team have also been working with members of the private business sector and the chambers of commerce, the BIAs. They've started to do coordination of those groups to look at our economic recovery opportunities and how we can best support businesses. Those have certainly taken place as well. And I also reported a moment ago about some of the outreach we've had from Chatham-Kent Health Alliance, Transform, and the Erie St. Clair Lynn from the health sector. So we certainly have looked at those. I think a little later on this evening, as Dr. Riedek will be talking a little bit more about some of the potential interaction you might have with one of the school boards. So I think people have stepped up, and the municipality has played a role wherever we can in doing the coordination, but I'm happy to report that there's lots of other groups that are also stepping up and doing some of that leadership work as well. And I think there's enough work that it's great if it's shared.
Great, thank you. A question likely directed to Dr. Riedek. How are we addressing the challenges of providing service to the homeless or near homeless? Understanding that with physical distancing, you know, those that are experiencing homelessness or maybe were couch surfing may not have those opportunities anymore, and are certainly vulnerable and at increased risk. So just wondering how we're adapting, and if we've seen a shift in need. You know, have we worked with any community organizations like Hope Haven to make sure that physical distancing is happening and achievable for these vulnerable folks?
Through you, Mayor Caniff, thank you for the question. I actually have a couple of slides prepared, so I'm wondering, Meredith, if I can get that up. Certainly, we are seeing some significant increase in terms of our vulnerable clients throughout the community, not just the individuals that we tend to see on a regular basis, but certainly as individuals in Chatham-Kent are being faced with decrease in their hours, people that are being laid off, we have certainly landlords trying to evict people, and certainly Ontario Works and my housing teams are working diligently to assist clients in providing them with some emergency support through our Ontario Works program. They're also assisting with providing financial help to others in the community, not just our Ontario Works clients, for individuals that are in need of food and shelter assistance with their utilities. Our housing team is trying to move people into housing as quickly as they possibly can. Our community navigators are manning the phones continuously all day long in terms of assisting individuals with getting and accessing and applying for employment insurance. So we still maintain and support a model of housing first to end homelessness in our community. The issue is that COVID-19 has certainly required a shift in our focus, as the need for immediate safe housing is required, and that has caused us certainly to look at adjusting our approach. So next slide, Meredith. So what has happened, and Councillor McGregor certainly said it when he talked about our couch surfers, we typically average about 85 individuals that are known to us who are homeless, moving around our community, receiving services from a number of areas. Right now, and in February of 2020, 84 homeless individuals we had contact with. That has bumped up over the last 2 weeks to 145. So a significant increase that we have seen, and this has predominantly been caused by our couch surfers, the typical kind of what we call in the field hidden homeless individuals, where they've gone from family member to family member, they've been sleeping in basements, they've been sleeping on couches, and with the concerns around COVID-19, they have been asked to leave. They've been kicked out, and they are now on the streets. We see them as we move around day to day, and we are certainly trying to look at how do we address this. Next slide, Meredith. So just to provide some numbers, we currently house individuals in motels across Chatham-Kent, and they have really worked very, very well with us in terms of emergency accommodations. But in March of 2019, we had 11 turnaways, and we classify turnaways as motels are unwilling to accommodate these individuals because of past damages or what their behaviors have been. This past month, turnaways were at 37. And then in terms of us providing and funding at least one night's accommodation to assist people, went from 36 last March all the way up to 53 this past March. Next slide, Meredith. So as I've indicated here, we have a total of 75 hotel rooms that we have been able to access in the past. What is going on right now is 31 of these rooms are filled with individuals that we, through Employment and Social Services, are financing. Hotel costs range around $2,400 a month, looking at whether or not we can isolate individuals and families. Certainly some of our hotel rooms are not suitable for really high acuity clients. A number of our homeless individuals certainly have mental health and addiction issues. We've had significant damages done to hotel rooms over the last couple of weeks that we are navigating through. And we are working really, really closely with our hospital so that they do not discharge clients from the hospital into homelessness. And that takes me to the next slide, Meredith. So while we are working very, very well with the hospital is still trying to decant patients from the hospital up until the point that they have 20 to 30 seniors that they are currently looking to move out of hospital. And we want to make sure that they are not homeless. We are working with one of our larger hotels in the community to move seniors into that hotel. But then what happens is that we're almost in competition for hotel rooms. So this has really led us to needing to look at opening up an isolation or a temporary shelter to get us through COVID-19. And then the next slide, Meredith, typically we place when individuals call our housing and homelessness line. Through last year, we were averaging around 25 placements a month where we moved people from homelessness into some permanent housing due to, again, the crisis that we find ourselves in. One, landlords are not willing to accept new move-ins. And to the point they're not even showing units that they have available because of some of the concerns. And then my last slide, in terms of working with, why do we need an isolation shelter? We are certainly working with individuals in the community, specifically Hope Haven. I've been in contact with them multiple times and our staff as well. They have decreased the number of individuals that can currently stay at Hope Haven, doing the best that they possibly can to ensure social distancing. They are concerned, we are concerned, and at this time, we certainly feel the need to open a shelter that we certainly assist in staffing, working with Public Health, Canadian Mental Health Association, Salvation Army, the Women's Centre, the police, and the hospital, and United Way, in a united effort to assist with our homeless population. It is pretty hard when we have the Prime Minister, the Premier, and our Medical Officer of Health telling individuals to stay home when you don't have a home to go to. So having a shelter will allow us, in the event that any of our homeless individuals end up testing positive for COVID-19, we will be able to shelter them and isolate them so that we can provide them with services that they require during that 14-day plus isolation period. It will allow us to shelter our ever-increasing number of homeless individuals that we have right now that are wandering around the community. I see them sleeping under trees and on park benches. And it will allow us to use the hotel rooms that we have in an appropriate way as we move individuals through a shelter into some permanent housing. We are currently looking at potential locations everywhere, with continuing to speak with some of our larger motels and hotels, looking at conversations with our school boards, and also looking at our own municipal facilities, and do we have anywhere that we own that could be really changed into a isolation transitional shelter. The difficulty that we have is that this will be in place for quite some time. Past economic downturns have really shown that it takes us about 2 years to come out of an economic downturn to assist our vulnerable populations in in really turning their lives back around, getting them employed, finding them housing. So anywhere that we do find, we are looking at running some type of shelter for about 18 months or so. So I think I will stop there and see if there are any other questions in terms of working with our more vulnerable individuals.
Yeah, thank you. I didn't have any more questions, maybe particularly about this, but I do think that you're very much right. That stay home message, while really important, is challenging for some that don't have a home, and for those that don't have a safe home as well. So, you know, home isn't always a place for everybody that there's a place they can stay. So I think it's really positive that we're seeing this partnership and looking for a longer term solution. But I guess to Mayor Caniff, understanding there might be some other questions other councillors might have on these few slides, I'd be fine to give the floor for that.
Okay, Councillor Hall, followed by Councillor Kirkwood White.
Thank you, Mayor Caniff. So I have three questions. They're not related to the slides that were just up, but three different questions, all related to COVID-19. Are we talking about the homelessness issue right now? Going up for more questions, or do you want me to continue with my questions?
Just continue with your questions. If we do have any other questions, April can respond to those.
Okay, sounds good. Thank you. So my first topic here. I was really happy to see that the municipality and Mayor Caniff sent a letter of support to Walpole Island First Nation and Moravian Town. I know those the communities there. They put in some measures to you know, to try to protect their most vulnerable individuals in those communities. So I was happy to see that we sent some support there. But if I can either send it to staff or even you, Mayor Caniff, to speak to that a little bit.
Yeah, I can speak to that, Councillor Hall. Yes, we sent out a letter, and Meredith will pop it up here so everyone can see it. We sent out a letter of support to both Moravian Town and and Walpole Island, supporting what they're doing as far as trying to control access into their areas. We've also, as a municipality, reached out. I've called both chiefs and put out anything that we could do for them. I put an open invitation for a call to see if there's some support mechanisms we can provide that we'd be happy to, and they were thankful of that. And to this point, we have not heard from them as far as requesting anything from the municipality, but the invitation's open.
Right on. Thank you, Mayor Caniff. And I just want to thank you again for sending that letter. I know we have especially here in Wallaceburg, we have a lot of individuals especially from Walpole Island that come into the community, and I'm thankful that we were able to send that support. My next question, so I've gotten a few other questions from the public about this, and it has to do with temporary foreign workers and how that process will be treated amongst this COVID-19 pandemic. Wondering if someone from staff can address this.
Mayor Caniff, this is John. I guess I will take that one. We have been working with the agricultural community, and the province has made some opportunity for temporary foreign workers to come into Canada, and for the agricultural community to continue to receive that very necessary support. So we have been very supportive of that, and council, I believe at the last council meeting, encouraged that. And economic development has been working closely with the agriculture community along these lines. We know that there's some places in our community where the temporary foreign workers are going to be housed during their quarantine period that they're going to have to undertake when they come into Canada. But we believe this is a very positive step, is to continue to bring in our workers into our community. It's such a vital part of our economy.
Excellent. Thank you, John. And one last question through you, Mayor Caniff. Another issue that gathered a lot of feedback from the community was the suspension of recreational fire permits. I thought it was a very progressive and a very forward-thinking move that Chief Case and his team with Fire and Emergency Services put forward. I know there was a press release sent out to the public, and I know Chief Case he sent some more details over in an email as well, so I was able to kind of forward that over to some folks that had questions. But I was just wondering if Chief Case might be able to speak to this a little bit and talk about why that decision was made.
Through you, Your Worship. Well, thank you for the question, Councillor Hall. So it was around the 13th of March when we realised that we had a significant issue with the COVID crisis. We took a decision to lock down the fire halls, and we do emergency essential calls only. We're no longer, at the moment, we're not doing any of our community education or our outreach work. We literally have our full-time officers who are in the hall with the doors down. No one's allowed into the halls, and they have to go through medical screening twice a shift, and there's a continuous cleaning of the station. Our volunteer firefighters have suspended group training. They're still doing the online training, but they don't come to the hall to train. Small numbers of them come into the hall to maintain the equipment and make sure the trucks are ready to go. The idea being that as if there's an emergency or...
Okay.
Can you hear me?
Yes, we can.
The idea being is that if there is an emergency call, well, that is a justifiable risk for interaction between the firefighters and the community. Now, following the lead of some neighbouring departments and the likes of London and Sarnia, and even the province has brought out a fire ban for the northern areas of the province, we decided that we would suspend the open air burn permits, and that accounts for around 300 calls a year. And that will be a call where someone sees smoke in their area and they call 911, and a fire crew is sent out to investigate the smoke and deal with the campfire. We thought it was wholly reasonable to reduce the potential for a firefighter to interact with a member of the public unnecessarily. And in the situation of a volunteer firefighter, that volunteer leaves his or her home, comes to the fire hall, gets on a fire truck, goes to the person's home where the fire is, interacts with that person, and then returns to the home. It's not a justifiable risk. So we've taken the action of just suspending open air burn permits for 28 days in the hope that it will reduce the calls. I can advise that we had 12 calls over the weekend, and as I'm speaking to you now, we have a fire truck on Glenwood Drive in Chatham dealing with a bonfire in a backyard. So as we haven't issued any fines yet, I can tell you that we're going to have to enforce this action because we're trying to keep our firefighters safe and we're trying to keep the public safe. I hope that answers your question, sir.
Absolutely. Thank you very much, Chief Case. And those are all the questions I have, Mayor Caniff. Thank you.
Okay, I will pass the floor back to Councillor B. McGregor, as I understand he has some other questions, and then we'll go to Councillor Kirkwood-White.
Thank you. Yes, I just sort of had seen the floor. I thought maybe someone might have some questions on homelessness, but I did have one other question. And I've seen a lot of feedback online regarding use of open spaces, and we've seen in other communities, namely in Toronto, they've closed some of the cemeteries because of people walking in them and not being able to respect that physical distance that's being promoted. So I'm just wondering what we've done as a municipality to promote that physical distancing and to make our outdoor spaces that are still available to be used. I'm thinking, walking on sidewalks or trails, how we're making those areas safe and making sure that people are respecting that physical distance.
Mr. Mayor, it's Thomas. So at this time, anywhere we have a closure like a playground, we put up signs, or ball fields, we put up signs. But when it comes to parks, we haven't put up any additional signs. We've really relied on the public through all of our media releases that has been sent out by Dr. Colby and by Public Health, that people will heed those messages. So we haven't done anything further than that.
Okay, and maybe could you just sort of ballpark how wide typically our sidewalks or our asphalt trails?
Our sidewalks are typically 3 to about 5.5 feet. Our standard is at least 5 feet. Our trails can be in the range of about, I would say about 6 or 7 feet, and sometimes larger.
Yeah, I think those are important numbers to think about when people are trying to do that 2 meters of physical distance. That if you are using a sidewalk or many of the trails, you couldn't pass somebody without one of you stepping off the sidewalk or stepping off the trail. And I think that's one of the things you see people struggling with a little bit, and hopefully it's something that we can get some information out on, so people are feeling safe when they're using those spaces. And that was all my questions. Thank you.
Councillor Kirkwood White, followed by Councillor Sakachi.
Thank you, Your Worship. Through you, I just wanted to thank Dawn and April for providing a little bit of an update on what's happening from the municipal perspective, and for mentioning the work that United Way has been doing over the last couple of weeks. And I wanted to give a little more detail on some of that information. I was talking to Steve Pratt today. United Way has released actually a copy of its collective COVID-19 community response and recovery strategy, which is focused on supporting our community's most vulnerable residents and to help them, be healthy and connected and out of the hospital. The team's been working very, very diligently over the last couple of weeks to bring our community together. They've included government and business, organizations, foundations, and philanthropists to rapidly identify needs, develop shared solutions, and to really quickly mobilize the resources. And I'm happy to tell you that a little over $140,000 has been raised just this week to support this particular response to COVID-19. There was a web portal launched last week under the name of ckgives.ca to help connect individuals who want to donate or volunteer with organizations in need of their support. Community leaders are letting us know how COVID-19 is affecting their work and what supports they might need. And Your TV, the Facebook Your TV channel, is actually hosting a daily check-in with the community at 3 p.m. on Mondays through Fridays. And tonight, an open invitation will be issued to all frontline serving organizations and community groups who are supporting our most vulnerable to join 9 different situation tables every Thursday from 8 a.m. to 10 a.m. And together, those situation tables will be identifying emergency needs and developing shared solutions. So if there are groups and organizations out there who wish to participate, I would encourage them to visit ckgives.ca for more information. This, with thanks to Dawn and Kathy and April for drawing this initiative to the public's attention. This is a real example of the role that United Way is playing in trying to bring people together. So I want to express my thanks to them and to you for letting us know that this is going on.
Councillor Sakachi, followed by Councillor Crew.
Thank you. Through you, Your Worship, I appreciate the time. I just wanted to make light myself that I'm very appreciative of all the work that's transpired and very supportive of all the efforts that the municipality has made, including the line, the hotline, as well as the fire burn permits, because of the fact that the sooner we can get through this, the faster that we can receive a somewhat normality to our community as well as to our businesses. I got 2 questions that are posed to me through from the community that I wanted to ask before I asked my question. One would be to Ms. Hoffman, is that you had stated that there's a 3-week period that would end inclusive today. There's several people in the community that are inquiring what happens to, for instance, like the lifeguards and that, after today? Are they going to be receiving notice? What is going to be transpiring effective immediately after the day's end?
Thank you, Mr. Mayor. So for, to use your example of the lifeguards, Councillor Sakachi, so we currently have our lifeguards who are sitting on our redeployment list. We've been getting in touch with them to find other positions for them as well as. And so we're hopeful that we'll be able to redeploy them to where we have surge areas, and where we can't, then we'll be going back to seeing what other possibilities are available to us before we're in a situation where they would be laid off.
Thank you. And regarding the redeployment list, one concern that I have that might be a loophole that I'm seeing is that we have so many different agencies that maybe are just community committees, different types of people in the community that run events, whether it be festivals, concerts, runs in the community. Is it possible to redeploy some of our staff to assist these people that have been making donations to the community, that a lot of these aren't even going to be able to function this year because of the donations that are going to be lost? For instance, a lot of businesses aren't going to be able to afford to sponsor certain things. So is there potential to have some redeployment of staff to assist with all these people in our community that go above and beyond to assist other organizations?
Mr. Mayor, thank you for the question. Right now, it's too early for us to be able to tell whether or not we will have employees that are going to be available to for redeployment to community types of events. That said, as I was speaking earlier to Councillor Latimer's point, we'll certainly add that to the list. And I think that would be a conversation that will be well suited for council when we come back in the next coming weeks. You'll hear a little bit more actually tonight from Mr. Quinton about some future reports and where we're at with services and so forth. So I think that might be a better time for us to start to examine whether or not we have capacity for staff to be able to be utilized and redeployed in that particular kind of way, which still adds value to the community.
Much appreciated. And through your worship, this will be my last question. And this one is going to be directed to Dr. Riedijk. I've received this question multiple times, and I'm not sure if other councillors have as well. But, and maybe Mr. Norton can chime in as well, is that there are people in the public that are concerned that many other municipalities, when they're visiting these sites that are being called, are actually enforcing things that they're mandating. So the concern I've been brought forward to me multiple times is that, and I don't know the accuracy of this, but many people have mentioned it, is that the people that have traveled who maybe did not self-isolate and have even possibly been tested as positive that hasn't self-isolated, what is being done from a community standpoint to ensure that when people are returning, that their time frame has not been expired and they're free to end their quarantine? What is being done from a municipal standpoint to address that? I think it's very important that the public is aware. I've read the literature myself, but I think it's important to ask and open, as well as when is it going to get to the point, to ask Chief Case's comments, when is it going to get to a point that we're going to say that this is a very serious issue and it needs to be addressed seriously? When are we going to be receiving that point to we're going to start addressing these with a more formal process?
So Mayor Caniff, do you want me to start? It's April.
Yes, please.
So I think, thank you for the question, Councillor Sakachi. I can only speak to the public health side of your questions and comments. So certainly individuals who are returning from travel from outside of Canada, you are correct, they are required to self-isolate for their 14 days. And those individuals are being advised of this when they return to Canada by border security and the individuals working, either land or air in terms of those returns happening. Right now, we do not have a way of receiving information on absolutely everyone. We certainly, and Kathy can address this, have asked our employees to self-identify, and we're keeping track of our municipal employees returning from travel. If we flip to the positive cases, so certainly anyone who we send for screening, for testing, we automatically ask them to self-isolate until their test results come back. If those test results are positive, then they continue with their self-isolation. Public Health works diligently to complete their contact tracing with all of our potential or positive COVID-19 cases and make sure that appropriate measures are put in place for self-isolation. We are in contact with these individuals on a regular basis, one, to check you know, and make sure that they are feeling okay during their self-isolation, and two, to make sure they are continuing to self-isolate. We too receive what I want to say are probably all to this point that have been false alarms, with individuals kind of, you know, unfortunately making a joke that they are positive when in fact they're not, and we're following up on those cases. We have not received any complaint for our positive individuals that they are not following all the rules and guidelines, and they are maintaining their isolation. So, you know, I want to, our numbers are low right now. We have systems in place to follow all of our people, and certainly to even redeploy within our public health unit if we require more individuals doing that contact tracing and following individuals if we see an increase in our positive cases. So that's the follow-up side of our positives. I'll stop there and see whether Kathy has anything to add from the employee side, and John from the enforcement side.
Thank you, Worship. No, I don't have anything else to add. I think, April, you said it well.
Your Worship, I don't really have anything else to add either, maybe except to say that if Dr. Colby gives an order, the police are compelled to, under this emergency, they're compelled to enforce those orders, and serious, you know, infractions would obviously be dealt with to prevent people who are tested positive from intentionally going around the community and affecting others. As April indicates, I guess there's no evidence of that right now, thankfully, happening in our community.
Thank you.
Scotchy, anything else?
I guess my question maybe was, maybe I could have stated it wrong, but my question was, wasn't once they were deemed positive, but the prior, so obviously there's been a lot of conversations in the media, so which then in turn, you know, a lot of people ask questions. So it's not once they were deemed positive, but there's been a lot of conversations about, say, maybe individuals returning from travel, not self-isolating, returning to work possibly, or other sanctions, then being deemed, you know, positive at a later date. So their concern is there any, their question was, what can be done for these people that, you know, that it's proven that they did not self-isolate when they came back, and then further date is, so this is just a community question, and I just thought it was important to ask. You've answered most of it properly, but I just wanted to ensure that I wasn't stating that once they deemed positive, they were in the community. My comment was just the ones that's, you know, that there's been attention and talk about in the media about potentially returning to work or other functions and such.
So through you, Mayor Caniff, certainly the best way, Councillor Sakachi, that I can answer that is any of our individuals that have come forward, whether or not that is to be tested, and they have been tested, they are following all of their self-isolation kind of mandate, as well as all of our positives that I've already talked about, so I won't go back there. In terms of individuals who return from travel and are not self-isolating, unless we know about them, we have no way of following up on those. So certainly we are open to putting out some more messaging, to sending some more social media reminders. But certainly I think we have done just about everything we possibly can for all of the individuals that we are aware of.
Thank you, April. And in closing, I just want to say I personally think that you guys are doing a fantastic job, you and your whole team. It's just important when we get asked these questions that I relay the questions to you. But I honestly think that you guys have done an impeccable team as a whole. The municipality working with public health, Dr. Colby, and I think that you deserve a lot of a lot of accreditation for what you guys have done. So thank you for all that.
Councillor Crew, followed by Councillor Foss.
Can you hear me?
Yes, we can, Marjorie.
Oh, good. My question's for April. Back to the slides about the shelter. My question, because we didn't have this ahead of time, so maybe I missed it in the slides, April. But is this going to be temporary? Is that the intent for the shelter? And is there funding? The government, both levels of government, have been announcing all kinds of funding here and there and for different things. So it's really hard to keep track of all of that. But you would probably be looking for something that is really a good size. You would need the social distancing, and I would assume you would need beds and rooms and some family areas. Is that what you're looking at? And are you going to come back asking us for direction, or is it just going to happen and that's fine? But my concern was about the funding, because we're really all going to be pinching pennies over this next little bit. And over this overall presentation, and this question probably for Dawn, but is there something going to come back asking us to consider different levels of service? I don't think you want us to do this on the fly right now. And that's how I'm just trying to figure out where we're going with this presentation in April. If you could answer that, that would be great.
So through you, Mayor Caniff, thanks for the question, Councillor Crew. So part of what we are doing right now is kind of taking a look and scoping out very, very quickly, because the need is certainly escalating day by day, to find a location to open up a temporary isolation shelter. Now, when I say temporary, we are looking at a timeline of approximately 18 months just to move people through, get people re-employed, assist with any of their other needs. So we have received funding for operational dollars, that is provincial money. And so we have earmarked a significant amount to go to operating some type of isolation shelter. The province has not yet come through with capital dollars in the event that we had to purchase some location for that. That's what we're exploring this week. But by 100%, we will be coming back to council with our top kind of location ideas for a go-ahead from council. And that might be an ask to take it out of our economic downturn reserve, with the hopes of securing some more funding as we move forward. Every day, the government's announcing additional dollars and additional funding. But the need is right now in terms of moving forward to get this running and operational. And we'll use any manner possible to receive provincial and federal dollars. But we will be coming back to council.
Councillor
I don't
Crew,
know.
with respect to your second, sorry, did you wish to follow up, or would you like your second question answered?
I was just going to turn it over to you, Don, for the rest.
Okay, thanks. Thank you, April. So in answer to your the rest of your question, tonight was about making sure the council had an understanding of what we had done to date over the initial couple of weeks, and also to share with council and the community what services we're currently offering. The intent is that we will come back to council in approximately 2 to 3 weeks and provide some additional recommendations as to how we can adjust levels of service and what that would mean from a staffing standpoint. So council will have some additional, certainly a lot more details in terms of the report, but we wanted to make sure people understood that we had already started to make some of those adjustments, and to ensure council was comfortable or supported where we're currently going. But we understand that with an event like this, in addition to us continuing to offer services, one of my previous slides talked about us requiring financial sustainability, and to respond to this event in a way that's in line with what council's directions are in terms of what services you want to continue to offer to the community in the mid to long term.
Thank you both.
The last speaker would be Councillor Foss.
Oh, wait a minute.
All right, yeah, Councillor Solomon, if you guys want to put your hand up there electronically, I'll get you in.
Yeah, I did that a while back. I guess it didn't twig.
Am I on?
You're on.
Yes,
Yep,
go
you're
ahead,
up, Councillor
Councillor
Foss.
Okay, thank you. I think tonight we've had a lot of good discussion on the COVID-19 and everything that the municipality is doing. And I'm very appreciative of all those involved and everything that they've done in putting the issues together and making sure that we get on top of this. I think we can't emphasize enough the importance of this and the importance of what administration has done. And I think the statistics of us having a low rate compared to other municipalities speaks well of what we're doing is doing the right thing. The one question I have, and I think I know the answer, but we talk about traveling from the States into Canada and other parts, but this also applies to people traveling from province to province. Is that right?
Councillor Foss, I believe that some provinces have made decisions to restrict travel. To the best of my knowledge, that has currently not, I have not heard an announcement about Ontario restricting interprovincial travel, but certainly there are other provinces that have done so. Nova Scotia and I believe Quebec have made some announcements in that regard, but I'm not sure if Mr. Norton or April have additional information.
I have no information from my end, Dawn, so can't help you with that one.
I'm pretty sure that New Brunswick has a policy in place there. So if you go from Ontario to New Brunswick, then you have to self-isolate. So, but I didn't know about Ontario. So anyway, thank you. That's my questions.
Councillor Solomon.
Yes. Thank you, Mayor Caniff. Most of the discussion that we've had in the last almost 2 hours has been about the current response to the COVID-19 pandemic. So while I too appreciate work done to date by our staff, I'm not going to repeat any of that. I want to speak to the longer term financial stability and the effects on the local taxpayers. Okay. I know we're going to get a report later this month, but I want to speak to it now so some of these things are included in it. I want to know what we need to do or stop doing to prepare for the problem that's going to hit us in the face come January 2021. You'll all recall that we were told at the last budget session that the 2021 proposed tax increase will be much higher than that which was proposed in the 2020 budget. And we felt pretty good at the end of 2020 budget because we were counting on increases in the assessment from new buildings, and we were counting on well over $1 million of new revenue from the casino, which is now closed. We weren't anticipating spending as much as we are at Erie Shore Road. And we also know, I've been listening for the last 2 hours, and a lot of what I've heard is going to engender new spending. So I want to make sure that our report that comes to us later takes into account the fact that, and I did hear finally after a long while, the mention that everybody's going to have to be pinching pennies in the next while. So many people are out of work. So many people are at the end of their financial means. Obviously, come next January, they can't be met with a tax increase. And I know that later in the agenda under item 12, we're going to hear briefly about some deferrals, but we should all bear in mind that there's going to be others who just aren't going to be able to pay this year. And so we all know, I take it, that we can't run a deficit as a municipality. So I'm hoping, I'm asking that we all get serious about the fact that we need to cut back any unnecessary expenditures and stick to our basic role as a municipality. In other words, just stick to our knitting, because it's not only now we're dealing with the health problem in our community, we're going to be dealing with the financial problem later, and that affects people's mental health and their well-being. So I wonder if Dawn can speak to that. I want to make sure that those things get covered because there is going to be no ability for a tax increase in 2021 or 2022, as someone pointed out. I think it was April. It usually takes 24 months to recover the financial side to recover. So, through your worship,
thank you for the question. Yep, thank you for the question, Councillor.
Be addressed?
I'll say to you, yes, and that work has already started. As you'll see from Gord Quinton's report later this evening, Gord's already starting to wrap his arms around some of the financial impacts of this. I think it's also important to note that John Norton has been leading a team and has done a lot of work on starting to look at the economic recovery components and how we can help support our businesses to get them up and running as quickly as possible. I think there's going to be a number of different approaches that we're going to have to deal with this crisis, but I could assure you that the administrative team, it's actually on our agenda tomorrow. We had a discussion earlier today, but tomorrow, given the direction from council, we are already starting the discussions tomorrow and on Wednesday to turn our minds to exactly the issues that you've presented today. And I can assure you that that's front in mind for us. Job one for the last 3 or 4 weeks, and it continues for the time being, is still the health issue. But we're very, very sensitive to the fact that we've also got to wrap our arms around the economic impacts of this crisis. Thank you for the question.
Your worship, thank you, Dawn. Just because I commented on the financial issues doesn't mean I'm not equally concerned about the health issues, but I'm wondering if one of the areas you could also look into is we have allocated over $18 million for an arena/recreation project. I don't think the province or the feds will have any appetite for that during this period of time, and I'm wondering if that's one of the areas that we can look to for some money. I don't expect an answer, just please consider that among those things that you're going to be dealing with. Thank you, that's all I have.
Okay, that is the last of the speakers. I just want to make a couple of quick comments. It's been some great discussion. There's a wide array of questions asked, so thanks for doing that. I think that with everything was asked, it helps give a better idea of what's going on. We mentioned, yes, about all the people, the municipality doing a great job, but firsthand, I've been working with all the senior leaders. It's amazing how they're stepping up. I wanted to mention as well, all the other people in the community that are stepping up, the frontline staff from healthcare, seniors homes, right to grocery stores, all the work they're doing. want to point out all the business and individuals that are stepping up, donating. Councillor Kirkwood, I mentioned 140,000 was raised, and that's just the tip of the iceberg as far as all the wonderful things that are going on. I also want to thank all the people out there that are listening to public health, that are doing all they're supposed to be doing to stop this spread. So literally, it's thousands of people coming together in our community. That's what's going to bring us through all this. So thanks for the questions,